The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guest or host are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Hello, everybody. My name is Dr. Paul Herkel, and welcome to the AOR Show. This is a podcast about everything to do with natural health, how to apply nutritional, supplemental, botanical, and natural medicines to take your health to the next level. This is our inaugural show, so it's the very first show that we're doing, and I think it's appropriate for us to talk about what actually orthomolecular medicine is, because after all, it is the AOR show. For those of you that don't know, that stands for Advanced Orthomolecular Research. So we're going to talk specifically about how orthomolecular medicine can take your health to the next level. We've all heard of things like naturopathic medicine. We've heard of homeopathic medicine. You may have heard of functional medicine. But we want to know how using nutrients and orthomolecular medicine specifically, and why a company, one of the leaders in Canada and now internationally, is decided to take the name of orthomolecular. And that's why we're going to start talking a little bit about that today. A good place for us to start is talking about what does orthomolecular even mean? So orthomolecular medicine was a term coined by one of the most famous doctors in the nutritional supplemental world. His name was Dr. Linnaeus Pauling, and he was practicing medicine and doing research in the 1960s. And he came up with this term called orthomolecular. And if you break down the word, it actually means ortho and molecular, which we all know what molecular means. Obviously, molecules, the stuff that things are made up of. Ortho, from the Greek perspective, means correct or right. So he was saying that we need to use the right or the correct molecule when we're doing anything that is going to have an impact on a person's health. And so he coined the term orthomolecular medicine, more specifically in around the use of vitamins and minerals and nutrients as it pertains to somebody's health. So that's what he found was something that was a bit of a game changer. Pharmaceutical medicine was really coming into its heyday at the time, and he was quite open-minded. So he started thinking about how do we use things that are naturally found in food? How do we use things like vitamins, minerals, and nutrients that are found not only in food, but in our bodies, that the body is using at every moment of every day to create physiology, to create function. And so he found through his research that you can use doses of these molecules, naturally occurring vitamins and minerals and other molecules. And if you use them in the right dose at the right time, you can start having a very, very powerful physiological effect. This is different than just getting nutrition through your diet. So that's the first important differentiation and distinction, is that this is not nutritional medicine. Nutritional medicine is what sustains a person on a daily basis. What are the foods that you're eating, and what are the nutrients that are essential for our body's function? But what Dr. Pauling was talking about, he was using higher doses, and he kind of used the term supraphysiological, which means higher than what your body normally would get in diet to have a more therapeutic effect. And so there's a couple reasons why you might want to use a higher dose of something. First of all, if a person's deficient, you probably want to use a higher dose to get that level up quicker. I use the analogy of a bucket or an empty bathtub a lot with my patients, specifically around vitamin D, because we're in Canada and vitamin D is a very deficient vitamin here in the Northern Hemisphere. And patients always ask, well, what's the right dose of vitamin D? And vitamin D is a perfect example of an orthomolecule. It's found in some foods and it's a natural vitamin. And the response that I give is that, well, what's your levels? And oftentimes we test their levels and they're very, very low. And so using the analogy of a bucket that's empty or a bathtub that's empty, I tell my patients that if you want to fill up your bathtub, do you want to sit there with a teaspoon and try to fill up your bathtub? And that would be the same analogy as using Health Canada's recommended dose of 1,000 international units of vitamin D. It's more of a maintenance dose. If your levels in your bathtub, or we're using the analogy of levels of vitamin D in your body, are perfectly normal, then you're going to be just fine with using kind of that teaspoon dose. But majority of people are actually majorly deficient, and some of them very quite so. So we need to use a higher dose to quickly supra-saturate or have supraphysiological effect to get those levels back up. And so once a person understands that analogy, they really get their head around what orthomolecular medicine really is. And there are numerous examples of how we can use that principle that Dr. Pauling came up with for the betterment of our health. And so specifically for Dr. Pauling, he really was looking at two main areas. He was looking at mental health, and he was finding that using higher doses of B vitamins, specifically B3, and one of his contemporaries and colleagues, Dr. Abram Hoffer, really took this to the next level. These are two names that you probably should know. These are kind of like godfathers of the nutritional supplemental world. And they were using higher doses of B3 to treat very, very treatment-resistant conditions like schizophrenia and depression. And so they found that when you were using these high doses, you actually had almost a drug-like effect. But here's the kicker, and here's the other important piece about orthomolecular medicine, is that these doses, these very high doses, they found they were very, very safe for almost all the people that they were using them on. Here's another example that Dr. Pauling actually was studying and using, probably what he's most famous for. He was using high doses of vitamin C or ascorbic acid in kind of terminally ill cancer patients. And he found that when you were using higher doses, so more than just the couple hundred milligrams that's recommended by typical regulatory agencies or government agencies, but you're starting to use gram doses. So vitamin C is a water-soluble vitamin, and anything more than what the body can use is going to be excreted. So this makes vitamin C really, really safe because the excessive toxic accumulation can happen. So Dr. Pauling started studying this and started having some really, really great effects. And he was actually using vitamin C intravenously, meaning directly infused into your veins. There's a lot of integrative healthcare practitioners that are using this approach, intravenous ascorbic acid for all sorts of conditions, probably most commonly known for cancer. And at the time, obviously, with any sort of change in the way that a doctor does things, there were skeptics, there were critics, and they were saying, well, this is not really having an effect. And a lot of the skeptics were looking at using those small doses of vitamin C, and they found that they didn't have the same effects. But the secret to Dr. Pauling's approach, and this is really the crux of orthomolecular medicine, was that he was using a much higher dose. And he was using it intravenously, which is even higher than you can get orally. But you can easily apply that to any sort of oral supplementation. And vitamin C often is used in conditions, for example, of stubborn chronic constipation. So people are using much higher doses of vitamin C. And we actually use the fact that it can loosen our stools at higher doses for patients that have very stubborn stools. So that's one example of using a nutrient that is found in fruits and vegetables, but using it in higher doses and using it super physiologically. There's also this idea that, well, everything should come from food. And this kind of flies in the face of orthomolecular medicine, Now, as a naturopathic doctor and somebody that, really is a huge proponent of diet, I couldn't agree more that majority of the nutrients that we get, and I say majority specifically because there are some nutrients that are simply not found in high enough doses in our food supply. Vitamin C is one of those things that is found in our food supply, but it's found in very small, maybe a couple 100 milligram doses. So this is great for kind of maintenance. But consider a couple things. This is one of the main reasons we need orthomolecular medicine. We need to look at supplementation, is that a lot of times we have a supraphysiological, so a greater than what you find in diet need for nutrients. So that is why we may need a supraphysiological dose. So for example, think of people around you, maybe even think of yourself, somebody that is under a lot of chronic stress. That's the affliction that's in our current society. And there are nutrients that help us deal with stress. Vitamin C is one of those nutrients. And so when you're stressed, you typically are not eating as well as you probably want to be eating, and you probably aren't getting as much vitamin C as you should be getting. Also to consider that, there are certain situations like intestinal inflammation or medications that inhibit the absorption of nutrients. A great example is something called acid blockers or proton pump inhibitor medications. These are very commonly prescribed medications. Typically, they're given for any sort of digestive issues. So if somebody comes in, they say they have nausea, or they have a little bit of reflux, or they have digestive discomfort, the first thing that your family doctor will try is this class of medication. Now, we can talk about that in another episode on what are some of the risks of medications and how they should properly be used. And I'm not saying we shouldn't use medications, but we have to consider that medications do have a downside, and that is that they actually can deplete some nutrients. And some of those are better known than others. And the example I'm using with proton pump inhibitors is that you're not going to be able to absorb many of your minerals. In fact, a lot of the proton pump inhibitor medications are now starting to have the warning on it to say, hey, it may cause low levels of magnesium. Magnesium is one of the most important minerals in our bodies for maintaining muscle function, maintaining nerve function. It's incredibly important for the blood flow throughout our whole body, so cardiovascular health. So you can go down the list. We'll talk about magnesium in another episode because it's that important. But suffice to say right now is that there are things that are competing for the absorption of our nutrients. And then lastly, consider that the change in our environmental and our agricultural practices may not have as many nutrients in our foods as we like to think. So we actually can see the nutrient levels. If you look at some research that is available, you start seeing levels have gone down over the last 5 decades. And that's, again, if you think about kind of the historical agricultural practices, there was things like crop rotation, meaning like if I had 4 fields, I would only plant 3 of them. And then every other year I would rotate through that empty field. So there would one of the fields would always be empty. And the idea is that that empty field would actually have crops planted in it that are not harvested, that are then tilled under, almost like fertilized. And so that's not really happening because of just the mass amount of people and the demand and the money that goes into some of the the commercial large scale farming that's happening when it comes to vegetables specifically. And so you get lower levels than you need. So to summarize, you need higher doses of nutrients, more than in your diet, because you might, because of your situation, stress, for example, or intestinal inflammation, if somebody's struggling with food allergies and Crohn's, colitis, other sources of intestinal inflammation. So that would be one of the first reasons why you need higher levels. Number 2, you actually may be depleting some of your levels with certain medications or things that a person's taking. These can be very common medications. For example, something like Advil can cause intestinal inflammation, which decreases absorption. So common things that people taking every day. So that's number 2. And number 3, our diet, our foods that we're eating every day, may not have enough nutrients or as much nutrients as we think that they have. So those are the 3 reasons why we need orthomolecular medicine. If you're taking any sort of nutrients or vitamins, you probably have been trying out orthomolecular principles if you've taken higher levels of them. And so what I want to focus on here for the rest of our show is looking at, number 1, how is orthomolecular medicine applicable to you? And what are some of the most common examples that have research behind them and are effective introductory ways of introducing orthomolecular medicine? And before we do that, I think it's important to understand, as part of understanding orthomolecular medicine in general, is where does orthomolecular medicine fit in terms of our medical system? So let's start with that. So we've heard obviously of things and professions like naturopathic medicine and homeopathic medicine and chiropractic medicine. So these are regulated in some states and provinces. This is a whole way of thinking and practicing a medicine. And this is different than orthomolecular medicine because somebody that is a naturopathic doctor like myself can practice orthomolecular medicine or principles of orthomolecular medicine. So orthomolecular medicine itself isn't a profession, but it's a way of thinking and practicing medicine or practicing bringing about better health. So a person, you could be taking high doses of vitamin D and be practicing orthomolecular medicine yourself. Or you could go see your naturopathic doctor and they give you high doses of vitamin A short term for acne, for example. And that would be an example of them giving you an orthomolecular prescription or orthomolecular recommendation. So that's how it kind of fits in. So anybody can actually use orthomolecular medicine. In fact, when I attended the orthomolecular conference, and there's a group here in Canada called the International Society of Orthomolecular Medicine, the conference was hosted in Vancouver of last year, and majority of the people there were medical doctors. There were medical doctors, naturopathic doctors, nutritionists, people from the public that were just interested in orthomolecular medicine. So it's really has followers and acolytes from many walks of life. And I think that speaks to just the broad range of applications that orthomolecular medicine has. There's also this term called functional medicine. And this, if you're in the natural health space, you've probably heard of it before. It's very popular in the US. There are a couple organizations that are now grown to be quite big with really big followings and international conferences that have started to certify primarily medical doctors in more natural ways of thinking, which I think is incredibly valuable. So one of them is called the Institute for Functional Medicine. And, a medical doctor that is now starting to realize, hey, you know what? My patients are benefiting from changing the way they're eating. My patients are benefiting from using nutrients and supplements. I actually need to know a little bit more about this. So they would attend one of these functional medicine conferences. So many principles that functional medicine, which really only started probably, I would say, in the last 10, 15 years, really becoming popular, they are been using and advocating orthomolecular principles for ever since they've started. So orthomolecular medicine's been around for a lot longer. And there's actually a strong international following of orthomolecular medicine. So for example, this next year, the conference is in Barcelona because there's a number of Spanish and Japanese, particularly from these countries, where they're very passionate about orthomolecular medicine. And primarily, these are medical doctors. So that hopefully gives you a little bit of insight and context on where orthomolecular medicine fits in. So you can practice orthomolecular medicine just by using higher doses. Now, higher doses doesn't necessarily mean unsafe doses. And I think this is one of the key principles that Dr. Pauling really drove home, was that he found that when you did use high doses, unlike pharmaceutical medications, which as the dose goes up, the toxicity level goes up along with it, using these natural substances, you can actually have very high doses and still have a very safe effect. A lot of this has to do with the character of the nutrient or vitamin. So for example, using a fat soluble vitamin like vitamin D, you have a much higher risk of toxicity. And the reason is fat soluble vitamins like vitamin D, E, K, and A, they build up in fat. That's why they're called fat soluble, meaning they are dissolved in fat. And then there are things like water soluble vitamins like B vitamins or vitamin C that don't have that same type of buildup. So their safety profile is even better. But my point about the fat soluble vitamins is that they still have a very good safety profile if they're used short term. And when I mean short term, 3 months to 6 months, that's kind of short term in a lot of orthomolecular medicine circles. But always from a safety perspective, talk to somebody that has experience and training in orthomolecular medicine, a naturopathic doctor or orthomolecular practitioner. And that's going to ensure that you're going to be getting the best dose that is safe for the duration and timing. And there are certain things that you obviously want to watch out for. And of course, doing some laboratory testing. So that's the first step that I do with patients. So I mentioned vitamin D, one of the most commonly supplemented vitamins, and most people are taking it without getting their levels tested. This is a small investment, about $30 here in Ontario, maybe a little bit more. But even if I had to pay $50 once a year, especially if I'm living in a northern hemisphere, and even if I'm not, actually, there's a lot of research showing that it has to do with your ability to convert vitamin D from the sun. So most people are indoors now. They're not getting enough. So even if you're living in a warm climate, you're still going to be at risk for vitamin D deficiency. And vitamin D is something we're going to talk about in a separate episode because it's just so incredibly powerful and actually is a neurohormone. But the point I wanted to make here is that, you need to test levels to actually know what you should be supplementing. And then working with a qualified, knowledgeable healthcare practitioner will help you determine what levels you should be taking. So that gives you a little bit of a context on safety and on the administration and application of orthomolecular medicine, where it kind of fits in. And what I want to focus on for the last little bit of this episode is, what are some of the specific examples? Like, how can you actually apply orthomolecular medicine? And this is the AOR show. I talked about AOR standing for Advanced Orthomolecular Research, because back in the 1990s when AOR was started, there really was not very good orthomolecular nutrient vitamin options on the market. And so it was started by Dr. Traj Nibber, who was a PhD pharmacist originally from the Ottawa area. Now AOR has been relocated to Calgary, and he came up with the idea that you can use some of these nutrients, and he was supporting an AIDS population. So if anybody saw the movie Dallas Buyers Club, it was like a vitamin buyers club. That was something that he started, and it was almost started out of need. And it really grew because people were looking for good quality supplements. They didn't find any of those in the shelves. There was nothing that really existed. So the story of AOR and its roots really came out of, we need to find a way to get these nutrients, these well-researched nutrients, out to people that need them, because there really wasn't quality on the market. And we specifically, AOR, the last word is research, because there still needs to be a lot of research that's done. There has been done. It started with Dr. Linnaeus Pauling and Abram Hoffer and Matthias Rath. And, these are some of the pioneers of natural and orthomolecular medicine. But there's more research that needs to be done. And that's something that AOR is very passionate about. And so they've actually evolved the definition that Dr. Pauling suggested to the right molecule in the right place at the right time, at the right dose and the right form. So Dr. Pauling talked about the right molecule in the right place, and AOR added the right time, the right dose, because that is going to give you further quantification of how it's orthomolecular. And all those things ideally should be satisfied for it to be truly optimal for a person's health and truly orthomolecular. So that's kind of the evolved definition. And in many ways, AOR as a company has forwarded and promoted the kind of good work that Dr. Pauling started. And AOR is very proud to kind of continue on that work. So how is a lot of this applicable to you listening? So I mentioned things like vitamin D. I mentioned things like magnesium. These are nutrients that are so incredibly important, probably some of the most commonly used. And I'm going to be doing shows, and we'll be having guests throughout the weekly shows that we're doing that are going to be talking about a lot of these nutrients. And I'm going to be breaking down some of them in a lot of detail so you're able to apply some of them yourself. But I want to bring up a couple examples that you can start looking into right away. So number one, I'm going to say, is vitamin D. Vitamin D, as I mentioned already, is the first thing you should look at is get your levels tested. That's how you're going to know is, do you need an orthomolecular dose, or are you okay with what you find normally as sun exposure? Just because you're in the sun doesn't mean that you have optimal levels. You should get tested. Okay, so 25 hydroxy vitamin D is what you should be asking your doctor for. They'll know what to ask for. Vitamin C probably is one of the most well-known. It's a water-soluble vitamin. Its primary role is around our cells. So all that, our cells are not just jammed together. Our body also has a lot of space between our cells. That's where a lot of communication happens. And vitamin C is kind of a really important antioxidant. There are some people that need higher levels of vitamin C. And so this is a good example that I actually didn't touch on before, but there are some people that need higher levels of vitamin C as almost an additional antioxidant protection, because on a genetic level, we don't have as many of our antioxidants. So for example, SOD or SOD, superoxide dismutase, again, this is something that we'll get more into when we talk about genomics. But for example, we need higher levels of antioxidants, and vitamin C is a perfect example. So getting it through diet like red peppers and oranges and a lot of those colorful fruits and vegetables are important, but using higher levels, especially when a person's under stress, when person's stools are sluggish, when person wants to kind of deal with any sort of cold, virus, and vitamin C is important to the immune system. So that's why it's always been traditionally used for that. On the immune system category, I think vitamin D also is very important for your immune system. So that's something that shouldn't be overlooked, but specifically zinc. So zinc is a really important mineral when it comes to our immune cells. And so zinc, again, found in small microdoses throughout the body or in diet, but really not enough to really boost the immune system. So I would say zinc is a really great idea, especially if somebody's looking to boost their immune system. The other big thing with zinc is that it's important for mood function, it's important for nerve function, and it's important for the production of some of our hormones, for example, testosterone. So a good evidence-based dose of zinc is 15 milligrams, and some people need much higher levels. Some people, I recommend taking it with food because it's going to have a little bit less of that kind of stomach irritating effect. It's not harmful, but it's just one of those things that happens. Some people get a little nauseous with zinc. So those are 3 examples of good orthomolecular nutrients, and we're going to be diving into a lot more of those. So that's kind of a sneak peek into what the AOR show is going to be all about. Hopefully you found this as a good foundation, as a springboard to get into some of the more advanced topics. And you'll be tuning in on a weekly basis to really listen to myself and a lot of the other experts that we're going to be having on to really understand how to apply orthomolecular medicine to optimize your health. Thank you for listening today. For more information about our guests, past shows, and future topics, please visit aor.ca/podcasts. Do you have a topic that you want us to cover? We invite you to engage with us on social media to request a future topic, or email us at marketing@aor.ca. We hope you tune in again next week to learn more about supplementing your health.